Hello and welcome to the Autism and Nutrition Where to Start webinar. I'm really excited that you've registered and taken this step to start or dive deeper into your biomedical nutrition journey. And I'm excited to share about my years of research, experience, and expertise. So to get started, just so you know who I am and who will be guiding you through this hour, my name is Brittyn Coleman. I'm a registered dietitian located in San Francisco, California. I provide services all across the US through telehealth, and I'm the creator of the Biomedical Beginnings group program and the Autism Nutrition Library, which is actually just pre-launched yesterday. I will tell you more about each of these. But there are very few dietitians who specialize in nutrition for autism, so I decided to take my practice nationwide and now worldwide to expand my reach to help educate parents about the importance of nutrition for autism. So I have my master's and my bachelor's in nutritional sciences, and I'm also a CLT, or a certified food sensitivity specialist. One fact that you may or may not know about me, I am also the sibling of an individual on the autism spectrum, and I love to talk about it. This is my brother, Barrett. He was diagnosed with autism when he was 2 years old and was nonverbal until he was 4. So thankfully, my mom, who is actually joining us today on the webinar, she's a psychologist who specializes in autism and could recognize the early signs. So she got him enrolled in early intervention services and has made some incredible strides since then. So on the right is a photo of us on mine and my husband's wedding day, and you can tell that he is a really big guy. He is 6'6" or 6'7", almost a foot taller than me, or more than a foot taller than me, and has come such a long way and even graduated college with his certificate of mastery in computer animation and design. So I say all of this just to tell you a little bit about my passion for autism. It's my profession, of course, but it is something that I truly care so deeply about, care so deeply about him as well. And as many of you who are joining on this webinar, autism is something that is likely very close to you, whether you have a child on the spectrum, a sibling, or you work with those on the spectrum. It's likely that somebody with autism has touched your life, and it just makes it so much closer to you. So just wanted to share my personal experience because he really is my why, and why I went into autism as a dietitian, and why I've essentially dedicated my entire career to educating parents about nutrition for autism. So as we get started, all that being said, in 2017, I stepped out of my job as a clinical dietitian and created my own private practice called Autism Dietitian. And through it, I've created my group program, Biomedical Beginnings. If you're interested in this, like I said, I'll give you the link after we finish up the webinar, and I'll send it in the recap email as well. But from here, I created my newest resource that just pre-launched yesterday called the Autism Nutrition Library. And this is the newest autism dietitian resource and also the most cost efficient. It's a platform to educate yourself about all things autism and nutrition. Everything I cover today will eventually be its own note in the library. And members will get access to new notes every single week and can request topics for our team to write. I'll give you more information about this to enroll if you are interested, and we'll give you the link as well. Before we get started, always just want to cover, I am a dietitian. I'm not specifically your dietitian, so everything that I'm covering in this webinar today is educational and is not meant to diagnose, treat, cure, prevent medical conditions. And this is a pretty standard disclaimer, but just want to make sure I cover this before we start the webinar. As we get started, I need to define a very important term, which is biomedical nutrition. I'll likely use this term multiple times. So biomedical nutrition is essentially the approach to nutrition that addresses underlying causes of illness. It focuses on the person and not just a diagnosis or a set of symptoms. The goal is to really treat the underlying causes, not just the symptoms. We often incorporate individualized results in biomedical labs to individualize our approach, and that can be done through stool, urine, hair, and blood samples. I do this all the time in my private practice. There are 3 approaches that we really want to take into consideration that I like to call the big 3. First, I always like to look at diet. Diet change is going to be what sets the groundwork, and individualizing a diet for a child can make all the difference. Next, I want to look at lifestyle, and lifestyle changes will help support them in their journey, whether this means helping the family choose non-toxic choices, getting into a good wellness routine, or other lifestyle changes. I want to address these as well. And third are supplements that I love to use when we target them, but they need to be used appropriately. So all of these recommendations for supplements come from reviewing food journals with my clients, biomedical results, and addressing any symptoms that we're seeing, as well as addressing those root cause. In a majority of cases, it's not just one of these approaches that works, it's commonly a combination of the three. I always remind my clients that everybody, whether you have autism or not, is like a puzzle. We all have different shapes, a different number of pieces, different combinations of pieces. We have to remember that different things work for different people, especially if you're on the autism spectrum. It's called an autism spectrum for a reason. What I'll be sharing today is a lot of the research that shows us how important nutrition is for autism and what's worth looking into. What makes autism more difficult is that there are many things that can impact it. So this figure shows how diet impacts individuals with autism, ADHD, and other neurodevelopmental disorders, and vice versa. There are many factors that need to be investigated, like the gut-brain axis, which we will cover today, food selectivity, nutrient deficiencies, GI issues, genetic mutations. There are lots of things to consider, which is why this can be so overwhelming, and I'm guessing which is why you're joining me today, because it feels very overwhelming. I always like to show how much autism research has really grown. Now, these are some very basic keywords that I typed here into PubMed. You can see I just typed in autism and diet, but just typing in those basic keywords shows how much the research has grown. And we can see the same for autism nutrition. Now, if we typed in autism and vitamin D or autism and other supplements, you can also see a similar trend. So what's really exciting is that we have so much more information to go off of. There's a lot of research out there. Of course, what we need for good research is more funding and more time. And that hopefully we're of course going to have more time, but we really need more funding for autism research. So I'm excited to be on the cutting end of this research so that I can share it with you throughout the Autism Nutrition Library so that you don't have to go constantly looking for all of the research that is posted. It's, like I said, very exciting to see after the year 2000, we really see such an increase in research studies. One of these research studies I'm going to share with you, and I share many over the course of this webinar, but this one is one of my favorite studies to show because it does show so many biomedical approaches and some really incredible findings about autism and biomedical. Now, this study looks at parent ratings of behavioral effects. This is not a clinical trial, so I always want to point that out. In the nutrition library, you will see that we always help you understand what the research is actually saying. So whenever it's just a parent rating, sometimes there can be some room for placebo, but with these scores, it's pretty impressive what they have to say and what they saw. So what we're going to do on this first page, you'll see right here, we're going to look at common medications. On the next page, we're going to start looking at some nutrition and dietary approaches. So what you'll see is these parent ratings look at progress or not seeing any effect, or maybe that the child got worse, and then they put it into a ratio. So we can see that they rate all of the scales and how they got better or worse. They put it into this ratio. So of course, a higher ratio shows that more people got better than they got worse. So the highest ratios that we can see are things like nystatin, intravenous secretin, IVIG, some things that have the highest ratios here. Now, of course, medications are outside of my realm as a dietitian, so I'm going to, of course, be careful about how much I tread here. Now, nutrition supplements are in my realm of practice and I can talk about them all day long, but I see that it paints a really interesting picture. IVIG is something that really can stimulate our immune system. In fact, it is intended for people who have decreased immune systems. Secretin is a hormone that can really stimulate our liver and our pancreas, which can indicate some digestive issues going on if somebody responded really well to that. And then we also see nystatin, which is an antifungal, which is very curious to me because many children with autism have yeast overgrowth, which we'll talk about today as well. So to me, that just shows us this whole picture here that individuals with autism are responding to treatments that really target the gut, the immune system, and our digestive tract. So one thing I also want to point out here, the highest ratio that we see is nystatin, which is 11 to 1. All of the other ones you can see generally around 1 to 1. Now let's look at supplements and biomedical approaches. What's really interesting is we start to see higher ratios here. So they're doing the same exact methods. They're looking at the same exact survey from the parents. And we start to see some of these ratios come up like 31 to 1, 32 to 1, and 30 to 1, which are a lot higher than what we were seeing across the board for the other section. We can see that some of these approaches like fatty acids or removing dairy, removing wheat, have these really impressive results. So I just love to share this with you that we see so much progress when we're working with dietary approaches versus just a traditional approach. So there really is so much that you can do, and you can really take advantage of diet and help improve your child's symptoms and also help them feel their best. So what's great, of course, is in the Autism Nutrition Library, we are including all of these approaches that you can see here. We won't have them all right away, but we will release them weekly to you. We have probably about 75% that are already preloaded into the library. So when everybody gets access to it on Monday, they'll be able to check out tons of these approaches and look into if these are approaches that they should be implementing with their children. All right, where I want to start next is with selective eating and picky eating. So I'm going to launch another quick poll and tell me if your child is a picky eater. No, somewhat, yes, definitely. And I'll allow about 10 seconds to get some answers in. All right, I'll let a few more people vote. Okay, so we have an overwhelming majority that says yes, definitely, a good amount that says somewhat, and definitely a minority that says no. Now, the part that I'm going to go over right now is going to be beneficial, of course, for all of you who said yes, definitely, and somewhat, but it will also be beneficial for those of you who said no, because just because your child will eat everything, doesn't mean that they currently are. So we will really cover everything today. So I just want you to know that you still will get a lot of benefits out of this, even for those who maybe aren't as picky eaters. Well, there is an estimated 5-fold increase in the odds of having a feeding problem for a child with autism. It's really interesting because we can see this across the board in the research, and we can see that kids with autism have higher levels of food selectivity, which are influenced by texture, color, and smell. On average, eat 20 fewer unique foods than their typically developing peers. We can see that they have higher rates of constipation that is also correlated with their severely picky eating and resistance to new foods. And some research studies show that half the number of foods in each food group are consumed except for starches. So we're eating enough starches, but the rest of the foods like fruits and vegetables are all about half of what we should be eating. So if you have a picky eater, this is really the first place to start. We really want to work on expanding diet so that we can get some of these great foods in to help benefit the rest of the body. And I'll talk to you about how to do that. There are various causes of selective eating. Sensory sensitivity is definitely one of the most common. We can see oral dysphagia, low muscle tone. This is where you should really get an OT or a speech pathologist involved to help see if your child does have any oral dysphagia or low muscle tone that could get in the way of them chewing something appropriately, GI issues, nutrient deficiencies, and certain medications. So all of these things really can impact a selective eater's diet. If you have GI issues, it can make you feel so uncomfortable that we can actually try fewer foods than we would if we were more comfortable. If we had no gut issues, no bloating or gas, constipation, diarrhea, you name it, you're going to be way more open to trying new foods whenever you don't have that discomfort. Certain nutrient deficiencies can cause lack of appetite or can even change your sense of smell and taste. Then certain medications can induce anorexia, meaning the lack of appetite, or even increase your metabolic rate. So if that's something that you're concerned about, definitely speak to your pediatrician about medications if you believe that they may be interfering with your child's appetite. I'll touch on sensory processing for just a quick second. So sensory processing disorder is a neurological disorder in which it impacts the way that individuals receive senses. Many people who have autism also have sensory processing disorder. In fact, just in the typical population, there's about 16% of people who have sensory processing symptoms. So what's hard about sensory processing disorder is that it's not recognized in the DSM-5 as a diagnosis, but we can all agree as healthcare professionals, and I'm sure as parents, that this is something that can really impact our children's ability to eat new foods, because eating is one of our most sensory rich experiences. And it can also impact other things like social skills or the clothes that your child will wear as well. Something we need to take into consideration is that we don't only have 5 sensory systems, we actually have 8. And outside of just your sight, hearing, touch, smell, and taste, we also have other symptoms like the sense of your head movement in space, or the sensation in your muscles and joints, or even hunger pains and GI discomfort. So we really have to take all of these into consideration when we're thinking about eating and sensory aspects. With autism, we definitely see an increased risk in sensory processing. So for kids who do have sensory processing and difficulties and autism, we can see that they typically eat fewer foods. And we even see one study says 65% of children with autism showed a definite difference in sensory processing, and 21% showed a probable difference. So that's about 86% of children with autism that show differences in sensory processing. And so this makes so much sense as to why we may have major issues with eating, because eating does take into account so many of your senses, if not all. Now, when we think of these picky eater foods, we think, what kind of foods are these kiddos typically eating? Typically, it's very few foods, which come down to a very low variety of nutrients. Usually we're eating the same foods over and over again, which can make you consistently miss certain nutrients, which over time, not just in a week or two, but over time, after months or years of eating the same foods over and over again, these can turn into nutrient deficiencies, which can cause symptoms to be worse, autism symptoms to be worse. Our gut microbiome, which I'll define for you in just a second, it relies on a wide variety of foods and fibers. And so when we restrict our diet to just a few foods, it can really impact our gut in a negative way. Most kids with autism have a strong preference for starches, snacks, and processed foods, and often reject fruits, vegetables, or proteins. It typically ends up being what we call the blonde foods, the foods that are delicious, they have a great sensory profile, but they don't have very many nutrients. And so a lot of the kids that I see that come in on my caseload that are really selective eaters tend to eat many of these blonde foods, my brother included. So as a child, I actually have a funny photo coming up that I found earlier. But just typical kid food that we're seeing as well, even kids who are not on the autism spectrum, what foods are we feeding them? We look at a kid's menu at a restaurant and they say chicken nuggets, French fries, hot dogs, chips, mac and cheese, pizza. You know, these are not gut building or brain building foods. And so we really have to think about, why are we giving kids these foods that just aren't very nutritious in the end? They don't have fiber or these vitamins and minerals. And so we want to add those foods back in, and I'll give you a full list and full lay of the land when it comes to those gut and brain building foods. So here's the photo that I was talking about. This is a photo of my brother and I, and you can see that he's eating a bag of Lay's potato chips and a little cup of Mott's applesauce. So this is actually something that he still does. He'll dip his chips in his applesauce. He, growing up, loved the blonde foods, which is, like I said, very common for kids who have autism and sensory processing disorder. But I just found it funny to see this photo of when we were so young, just really depicting what I'm explaining today. So I will say that he really has expanded his diet, and we're very proud of him. So wanted to slip that in there, that he has done a great job of expanding his diet. So the problem with blonde kid foods are that they're typically low in fiber, they're lacking many vitamins and minerals, they're completely lacking omega-3s, and in fact, usually they have a lot of omega-6s, which omega-6s are inflammatory, while omega-3s are anti-inflammatory. They also tend to have many saturated fats, they're high in simple starches, they have high levels of processed sugar, they often include artificial ingredients like dyes or preservatives, which aren't a brain-building ingredient either. In fact, many people have reactions to this, like hyperactivity or skin issues from artificial ingredients. And these processed foods are also have a higher likelihood to contain a variety of toxins like pesticides coming from our non-organic foods, plastics from packaging material. There are many things that we really have to consider when foods are very packaged. It's not just the nutrients in them. Now, that's the biggest part of it, but we really have to consider what's included in manufacturing the foods too, and trying to get the fewest ingredients, the most whole foods possible is going to be the best approach in the end. And the last thing is that many of these foods do not benefit the gut microbiome. Now let's look at the gut and let's funnel some foods in here and see what the gut has to say. So let's throw in some blonde foods and see what the gut thinks. So these foods are very low in fiber. They don't have very many nutrients, very low in omegas. They don't have a lot of these gut building nutrients. The gut is not going to be very happy whenever we throw those foods in there, because what you eat, really what your gut is eating too. And so it's really important that we're feeding our gut foods that are rich in fiber, lots of nutrients to really help our gut be its best. Now let's see, what if we put in some fruits and vegetables and fiber and funnel that to the gut? Now we have a very, very happy gut that is getting the nutrients that it needs to flourish and be its best. Now, when we're talking about the gut, many kids with autism struggle with constipation. That's one of the most common symptoms that we're seeing. So before I keep going here, I do want to know, do any of your children have gastrointestinal issues? I'll launch that poll now. So let me know if it's a recurring issue for you, sometimes, not always, or not at all. All right, about 5 more seconds. All right, okay. So we can see from those of you who voted, we have about 60% of people who are saying yes, that GI issues are a recurring issue. About 40% say sometimes, not always, and only 5% that say not at all. So GI issues, as you can tell from the results in this poll, are a major issue in autism. And it's not just constipation. We actually see many other issues like diarrhea or reflux, bloating, stomach pains, excessive gas. All of these things can be major issues. And like I said, if we're having this discomfort in our gut, it can really impact our ability to try new foods if we're feeling discomfort, or it can impact our ability to sleep. A lot of GI issues can be linked to sleep as well. So there's many things that the gut can impact. Next, I want to identify what the microbiome is. I said it a few times in this webinar already, but our gut microbiome is one of the most important things that we really need to consider in autism. We can have microbiomes anywhere. We have microbiomes in our mouth, on our skin, in our gut. And this essentially just means the combined genetic material of bacteria, yeast, viruses, whatever it may be that's in one space. And so for autism, we really need to think about the gut microbiome. And that's where most of the research is really taken off, is in this gut microbiome space. Now, if we look at what the research has to say about the microbiome and autism, we see that there are alterations in that bacteria. Now, we want to have a good balance. We want to have good bacteria in the gut and as little bad bacteria in the gut, so that we can have this really nice balance. So when we have these alterations in the shift of more bad bacteria in the gut than good, then we can see why we may be having some of these really severe gut issues. There's even interesting studies that can link severity of autism down to gut health. And what's really interesting about gut health as well is that our gut health and our bacteria that's in our gut actually can determine which foods we want to eat. So this is another factor coming into picky eating. The more foods that you eat, like let's say that we're eating lots of starches and carbohydrates and sugars, those are going to feed our bad bacteria. And when those grow and overgrow, they're going to want more and more of those foods that feed them so they can continue to stay alive. Whereas if we eat very high fiber foods and the bacteria that are fed by fiber are good bacteria, whenever we feed them and they grow, they cause us to crave more of those beneficial foods that are going to help them grow. So it's really interesting to see how your food cravings can really change whenever your gut bacteria changes too. And then, like I said, our gut bacteria can correlate to autism symptoms. There's a really interesting study to say that the kids who have the less diverse microbiome, meaning that there aren't as many bacteria that we'd like to see, we want there to be trillions and trillions of bacteria in our gut. Whenever we don't see that amount, we can see that autism symptoms can be more severe. So this is definitely a place where we really want to focus our efforts. You might be wondering, okay, so we've talked about the gut, but why does this even matter? Why does gut health matter in autism? Why should I be focusing on this? Well, if you guessed, the gut and the brain, how they, going from the gut to the brain, you guessed it, because there is something called the gut-brain axis, which is a bidirectional link between the gut and the brain. So this really means that if you have a healthy gut, can have a healthy brain as well, and vice versa. The gut-brain axis in autism is really interesting because it shows that the bacteria in our gut can really impact our emotions, stress, anxiety, our behavior, social interaction, and like I said before, our food preferences. So this is something that is still gaining a lot of research. We have a lot more research to go, but this is really promising. So looking into the gut-brain axis should be one of our primary things that we should do whenever we're starting out with diet for autism. Now, we talked about the gut, we talked about how it benefits the brain, but I also want to talk about some nutrients that are really beneficial for brain health too. So here we have a happy brain, and we're going to funnel some foods into it. So let's funnel some nutrient-dense foods, all of those fiber-rich foods, ones with lots of vitamins and minerals. We get some healthy fats like omega-3s that are anti-inflammatory, whole food ingredients, fruits and vegetables, legumes, nuts and seeds, minimal sugar, balanced microbiome. We have a really great gut health. We're feeding the gut the nutrients it needs. It has a good bacterial balance. And we are reducing toxins in our environment, whether that be through our food or our water or our air. That might mean air filtration or water filtration. It could mean avoiding toxic cleaning products or toxic personal care products, and just avoiding as many toxins in your day-to-day life. Now, this isn't only good for autism, it's also good for your entire family. So a low toxic lifestyle, something that I'm very passionate about. If you're on Instagram, you'll have to go check out my my highlight on non-toxic lifestyle so that you can read through some of my recommendations, because I believe this is so important because many kids with autism can't detox very well. And so if we keep our toxins to a minimum, we can allow the body to, and your liver and your detoxification process to be able to work better and more efficiently. Now let's think if we put some depleted nutrients. We're eating a really picky diet. We're not eating very much. We're eating the same foods over and over again, those blonde kid foods. We add in some inflammatory fats like omega-6s, artificial ingredients, starch and sugar. We have a bacteria or a gut microbiome that is not balanced, and we have lots of toxins that are coming in. Now that's going to make for a very unhappy brain. So what we're aiming at here is to get our diet in the place where we have a very happy gut, we have a very happy brain, and there's a lot of overlap here because they do relate so much, and they also want the same nutrients. I want to touch on omega-3s really quickly because this is where I get a lot of questions. So omega-3s, we can see that kids with autism are more likely to have a deficiency or an insufficient intake of omega-3s. Now, not having as many omega-3s as we need, it can actually cause abnormal development in childhood. It can result in a lack of concentration or hyperactivity, dyslexia, dyspraxia even. And so this is something that we really need to focus on, getting more omega-3s into the diet. Now, omega-3s are commonly a food or a nutrient that many picky eaters miss out on. And you have to be very mindful whenever you're trying to get in omega-3s because they only occur in certain foods. What's neat about them as well is that they have been linked to reducing inflammation, supporting brain development, and improving mental health. Some examples include some fatty fish like mackerel, salmon, herring, and then also some other plant-based sources like flax and chia and walnuts. Now, the best and most active source is going to be fatty fish. This is because it's already activated. The fish is already activated into the way that our body can use it. Whenever we consume a plant-based source, our body has to go through an additional activation so that it turns it into this active omega-3 that our body can use. And there's some evidence that kids with autism have a hard time doing this. More research definitely needs to be done, but if we're in doubt, I think my inkling is that we should go with the foods that are already going to be active. And that goes for many other vitamins too, like folate and vitamin B12, which I have too much to say about those. I won't be able to cover those extensively, but are two very important nutrients that I cover fully in the Autism Nutrition Library. You wouldn't believe how much information there is on vitamin B12 and folate in autism. Omegas aren't the only nutrient deficiencies that we see in autism. In fact, we see that kids are commonly eating fewer macronutrients and fiber compared to children without autism. In fact, caregivers reported that 67% of kids with autism omitted vegetables and 27% omitted fruits. Well, the first thing that I can think of here is that we're missing out on tons of fiber, which we know is great for gut health. And we're also missing out on all of those incredible beneficial vitamins and minerals that we find in vegetables and fruits. So it should come to no surprise that oftentimes we're lacking many micronutrients like calcium, vitamin B12, vitamin E, vitamin D, and kids with autism with selective eating are more likely to be at risk for at least one serious nutrient deficiency. And I think that nutrient deficiencies are something that aren't talked about enough. And it's something that sometimes people feel like, oh, you know, we're eating enough. We can't really have a nutrient deficiency. We typically see these in third world countries. No, we're seeing these all the time in the US. We see that we are eating too much food with not enough nutrients. And that's where obesity comes from. But I won't go down that line. But we can see if we're not eating the right nutrients, we really can lose out on those nutrients over time, which are so important for brain health, gut health, our organs, and our skin. There's so many things that really rely on those vitamins and minerals. Some common causes of nutrient deficiencies include a restricted diet, whether the child is really selective, or maybe they are on a very narrow diet because we are trying to improve symptoms. So for example, I'll just pick on the gluten-free diet right now, following that for a long amount of time, we're avoiding lots of vitamins that we find in glutinous grains. And so it may be helpful for us to supplement if we're using a specific diet, or else we might miss out on that because we're missing out on certain chunks of food or food groups over a long period of time. We can also see that poor digestion or something called malabsorption, which is an issue where you can't absorb the nutrients very well, even if you're eating all of them. And these are two very real issues in autism because of gut issues. Then we see problems with something called methylation, which is a process in the body on how to, or one of the major parts of methylation is getting in folate and B12 into our cells. If we can't do that, and our body flushes it out, or we just urinate out without absorbing it very well, that's a problem. Then we see certain medications that can cause nutrient deficiencies. And again, I would encourage you to speak with your physician to ensure that you are not, none of the medications that you're currently using would put you at higher risk to lose out on some of those nutrients. For malabsorption, I think this chart is really interesting to see because it shows us all throughout the gut where different nutrients are absorbed. So some nutrients are actually made in the gut. So like vitamin K and B vitamins are made in the gut. So when we don't have the right bacteria, we can actually really be depleted in those nutrients because we're not making enough. Some risk factors for malabsorption include poor digestion, candida, we'll talk about that in a second, and some other things called leaky gut or dysbiosis, and I'll define those three for you. Prolonged use of antibiotics can wipe out the good bacteria in our gut, which is very common in autism. You can see that people who have food reactions, that can cause a lot of inflammation in their gut, and it can cause people to not be able to absorb the nutrients very well. Something like celiac disease is a good example. Now, I wanted to define those three gut issues that I just talked about, dysbiosis, yeast, and leaky gut. Dysbiosis means the imbalance of the gut. So we've actually talked a lot about this without you knowing the term for it. So what this means is that we have a higher amount of bad bacteria, lower amount of good bacteria, and it's imbalanced. And we can see that individuals with autism have higher rates of dysbiosis. And what's the issue with this is these bacteria, the bad bacteria, can release unfavorable toxins or gases that can inflame or damage the gut. And that can become a big problem. We'll talk about leaky gut in 2 slides from now, which is definitely, dysbiosis is a major risk factor for leaky gut. So like we talked about, this bacteria can affect our food cravings, it can affect our gut-brain connection, and really play into increased autism symptoms. Yeast overgrowth is the excessive growth of yeast in the body. So this is different from dysbiosis because dysbiosis really looks at it all, mostly bacteria, but yeast overgrowth is specific to something called candida. Well, there are many different types of yeast, but candida is the specific one that we see the highest rates of yeast overgrowth. And we can see that this is very common to see in autism as well. The risk factors for high yeast overgrowth include antibiotic use, high levels of sugar intake, low stomach acid, dysbiosis, a poor immune system, so we can't fight that off. And kids with yeast overgrowth can be very bloated, they can complain of GI pain, they may be very fatigued, have diarrhea, even constipation. Sometimes you can even smell it, it smells very yeasty. And the yeast overgrowth can actually cause neurological side effects like brain fog or ADHD and some goofy behavior because of the toxins that it releases. Whenever our gut gets so inflamed, some of those toxins can actually leak out of the gut, and that is what is called leaky gut. So you can see that yeast overgrowth can actually display, it doesn't just have to present just in the gut, it can show up in other areas of the body too. So like oral thrush, for example, if you had an infant that had oral thrush, that's an example of yeast overgrowth in the mouth. But what we have to think about is that our digestive tract, it starts at our mouth and it ends at our anus. So we have this full tube. So if you have yeast in the mouth and you don't have great digestion, that yeast can also end up in the gut. Now, leaky gut, like I mentioned, we see that it's higher rates in autism and that it can cause some major GI symptoms. And I'll show you a photo so that you can actually see this and visualize it. So on the left, you'll see these normal, what are called tight junctions. These are our gut cells that are very pink, they look very happy, and they're all very close together like they should be. There shouldn't be anything that can get outside of your gut. Your gut is supposed to be a closed surface. Now, whenever we start having inflammation and toxins and all of these things that are causing issues in our gut, those cells start to become very leaky and inflamed. So you can see here it's starting to get agitated and it's very, or starting to get inflamed. And here we can have a gut cell that is extremely inflamed. Now you can see that they can, when they do get inflamed, they start to open up these little spaces where toxins or even food proteins can leak out. And so this is something that we really have to pay attention to because it can cause major neurological changes. So the way that I test it in my practice, I use a stool sample. I like to use the GI map, but there are many others out there that you can test for something called zonulin, which can quantify leaky gut. So this is something that we need to address. Leaky gut can be treated. We need to make sure that we address the gut, and we do that by addressing diet and our environment as well. There are many things to address this. So after all of that, you might be saying, okay, so we've been through a lot. Where can I actually start? Now, I hope the answer is you can see some areas where we should start. And I hope that first answer is, we should start in the gut. So I always recommend starting in the gut first in order to benefit the brain. But like I said, for those really picky eaters, we really need to start with feeding and expanding diet first in the short term to get you into a good place where we can start to eat these other foods, because that's really easier said than done. If we can't get a child to eat a food, but we have the perfect diet set out for them, we've cooked the perfect meal, we can't get them to eat it, what's the point? So I would really recommend looking into something called SOS feeding therapy. It stands for sequential oral sensory. And what I'm going to do is send a link to that in the recap email. You can also just Google it and find a therapist nearby you. But this is an occupational therapist or a speech pathologist who specializes in feeding. So that would be a great place to start as you're implementing diet too. So having a dietitian, having an OT, speech pathologist, feeding therapist, all on your team can really help having the best changes and the most progress. So the foods that can actually help us nourish the gut and the brain, we've talked about a few already, but the first thing we want to do is remove some foods. And we want to remove our processed sugars, remove artificial ingredients, our junk foods, foods with glyphosate, which is a pesticide that we can find in many non-organic foods. Now, the issue with glyphosate is that it doesn't only kill, it's a pesticide, it doesn't only kill pests or bugs, it also can kill the bugs in your gut too, like your bacteria. And so this is something that we definitely need to consider. And we can also see that it's neurotoxic for many individuals. And when I say many, no human should consume levels of glyphosate. Then we see high-risk foods that many kids with autism react to. Now, the most common are gluten and dairy, but that doesn't necessarily mean that everybody with autism is going to react to gluten and dairy. They may also react to soy and corn and some of these other foods too. So food sensitivity testing can be very helpful here to remove these foods. And whenever we remove these, overall, all of these are very inflammatory foods. Whenever we can remove these from the diet, we're really helping reduce inflammation in the gut, in the body, and in the brain, which is what we want. And the last thing is reducing toxins in the lifestyle, whether that means through our personal care products, through our cleaning products, water quality, air quality, the quality of our food. Buying organic is one of those great changes that you can make pretty quickly. That is a really great place to start, because removing toxins from your day-to-day, that's a long-term journey. Same with all of these things here. If you're feeling overwhelmed by doing all 6 of these recommendations here, start where you're ready. If there's one thing that you can start with and work your way up from there, that is so much better than not doing anything at all. I always say, do not let overwhelm turn into inaction. And I really want you to hear that again. Don't let overwhelm from dietary changes turn into inaction. It's way better to start with one change and work on that and master it, and then move on to the next thing than not doing anything at all. The next thing that we want to work on after we remove those foods is adding back in. So let's increase foods with fiber and prebiotics, these foods that help build the good bacteria in our gut. These are foods like fruits, veggies, whole grains, legumes, seeds, and fiber supplements are also an option here as well. I always prefer to use whole foods whenever we're trying to build up fiber in the diet first. Fiber supplements can be great and can help fill in the gaps, especially if we have a picky eater. We also want to work on probiotics in our food, things like fermented foods and drinks. Probiotic supplements are also great for those who won't eat kimchi or kombucha, or yogurt can also be a good source of probiotic, but not all yogurts are created the same. So it's important that we have one with low sugar, no artificial dyes. Like Go-Gurts are not the best source of yogurt, something that can really provide that beneficial bacteria. By the way, probiotics, fermented foods, probiotic supplements, all of those are completely covered in the library. We have extensive notes about each of those, how to choose a good one, when to use them, if they're safe for kids, everything that you need to know. Same with fiber. And the last thing is omegas. We want to build in some omegas into the diet, things like fatty fish, flax, chia, walnuts, or omega-3 supplements. And like I said, I would focus on the fish-based sources so that you have that active source of omegas that's coming in and your child's body doesn't have to convert. And then lastly, in our environment, we want to get lots of sunshine and fresh air. And then water and air filtration can also be a great way to clean up the environment too. For water filtration, I really love the Berkey filter or AquaTrue. For air filtration, I love the Air Doctor. We just recently got one. Being in the Bay Area right now with yucky air quality with the fires, it's been a total lifesaver to have the Air Doctor. Thankfully today, the air quality is so much better. So, but if you are interested in one of those filters, by the way, the Air Doctor, I would 100% recommend. And I actually have a coupon that they gave me for everybody who is at this webinar and my followers. So if that's something that interests you, I can send that out in the email as well, the follow-up email with the replay. So what next? So I know this was a lot of info just for one webinar, and I could truly have a full day summit. In fact, my Biomedical Beginnings group is essentially that. It's just spread over 8 weeks. I talk through food sensitivities, the gut-brain axis, nutrient deficiencies, toxic load, how to really address those things with autism. And so imagine what you would typically do after this webinar. So you get off this webinar and you might already be doing this. You might be Googling, you might be typing in leaky gut or dysbiosis and trying to figure out if your child has any of those signs. What you might be finding is that the resources that you're getting may not be reputable. You don't know if it really applies to autism, and you just really don't know where to turn. So instead, you're really needing a trustworthy place to find out more about each of these topics without spending hours on Google, because I don't know about you, but I've gone to Google for something and come out an hour or two later and just felt even more confused. So if this is you, the Autism Nutrition Library is definitely for you. It is a hub for autism nutrition, and it essentially brings all of the nutrition resources together in one place where you're getting nutrition advice from a registered dietitian, and you can trust that the information that you're seeing is research-based and that it does apply to your child with autism. So the Autism Nutrition Library thoroughly covers supplements. So supplements like probiotics or prebiotics, fish oil, glutathione, multivitamins, everything that you can imagine and you're curious about to use with your child. It covers it all. It covers all of the research and how much you should use, what would benefit, what are the risks factors that maybe you should be using that supplement. We also talk through nutrients like macronutrients like proteins and fibers, carbohydrates, micronutrients like vitamins and minerals, lots of foods, chemicals, symptoms, and conditions. So symptoms might include diarrhea, constipation. If your child is experiencing those, you can go into the note and see what nutrition approaches you should be applying. Then we also see conditions, of course, autism, ADHD, the MTHFR gene mutation, leaky gut, all of these things are covered extensively and linked to all the other notes so you can stay just in one place. So what's really neat is you can actually take it on the go. You can access it from your computer, but you can also access it from your mobile phone or your tablet too. So this is meant to be a resource for you whenever you are you're confused on what you should use. And if you need it right then, you whip out your phone, you whip out your computer, you go to the Autism Nutrition Library, and you can get reliable information right away. So another huge feature about the Autism Nutrition Library is that there's an exclusive Q&A. So if you do have questions that aren't covered, I can answer all of those monthly. I do a video for all of the members in the library, and you're able to ask any question that you need. You can also request new topics to be covered. So if there's something that you want to be covered there, like a certain symptom that your child is experiencing, you can request it, and my team and I will develop the note for you. So you can sit back, you don't have to worry about researching or spending hours. You can get your free time back and spend more time with your kids too. We'll send you a weekly email letting you know what notes are new on the library so that you can go and explore the new notes. What's exciting is that the pre-sale is live until Sunday, September 20th at midnight. So on Monday, this coming Monday, the 21st, is when the Autism Nutrition Library will become live, and it opens up to everybody, and that's when the pre-sale pricing goes away. So right now you can join for $9.99 per month and you lock in that price, or $99 per year. And again, you lock in that annual price too. So on the 21st, the price will increase to $14.99 per month or $149 per year. So you can save up to $50 per year if you wanted to pre-enroll now. Or so if you do want to enroll and join the Autism Nutrition Library, you can go to either bit.ly/ANL join, or you can type in autismnutritionlibrary.com and you can join from that page. I would love to connect with you. You can connect with me on my websites, autismdietitian.com or autismnutritionlibrary.com, or on my Instagram, which is the best place to get in contact with me, Facebook and Twitter as well. I would love to now open it up to Q&A, just like I wanted. We're right at 6:29 Pacific, which is almost exactly 1 hour. So I do see that there's some questions that have popped up, and I can go ahead and answer those now. So what I'm going to do is turn on my video so that you can see me again, and I'll stop my share so that you can see my full screen. So I'm going to pull up Q&A. And the first question I have is about glutathione. So glutathione, she says, on your Instagram, I saw glutathione listed in a post. Could you explain more about what it does and how it helps autism? So glutathione, I wish I could have an hour to talk about it, but it is extensively covered in the Autism Nutrition Library. But glutathione is an antioxidant, and what antioxidants do is it helps correct damage in the body from something called free radicals. Free radicals can appear whenever we don't have an ideal diet, or whenever we have a lot of pollution in our air or water, or we can't detox very well. So glutathione can really help with that detoxification process and with antioxidants. I think glutathione is a really great supplement to take. There are certain foods that can actually help you produce more glutathione in the body, and it's a great supplement to take as well, but it doesn't taste great to take as a supplement. There are certain ones that I use and I recommend them in the library. But just a heads up, it's not always the most kid-friendly taste, but it is so, so great for kiddos who can't detox very well. Somebody asked if I can speak a little bit more about how to support methylation. So like I explained, methylation is a process that involves many, many different things, but one of the most important is the conversion of B vitamins. And two of the most important here are vitamin B12 and folate. So whenever we can't methylate very well, that means that we cannot turn the inactive folate or inactive B12 that we find in fortified foods and in many supplements. And our bodies can't turn that into the active form that our bodies need. Now, if we take it in the active form from our food or maybe from a supplement that is already active, like methyl B12 or methylfolate, we can help that methylation process, which can be helpful for brain health, detox, our cardiovascular health. There's so many ways that it benefits. So like I said, I have a full note all about B12 and folate, each one, and I would definitely recommend looking those up in the library when it goes live. I'll also have a note all about the MTHFR gene mutation. So I plan to add more genetic mutations later on, like the COMT gene, but we're just starting out with the MTHFR gene mutation because it's the most implemented in autism, or indicated in autism. All right, next question. I am an OT specializing in feeding, and our RDs often recommend Miralax and Pediasure for our picky eaters. Do you have a good replacement for those, as one is a prolonged medication and the other is dairy-based, which is inflammatory? Yes, I actually have tons of resources on this on my Instagram. So there's a post that I have that talks all about Pediasure and how there are tons of other options. So I actually give some other options that you can purchase. One is called Ripple, and it's a pea protein, so it's not dairy, and it also has very minimal ingredients. It has the same amount of protein and the same, actually twice the amount of calcium as regular cow's milk. So that is a really great one that I often recommend. I also, on that post, have a recipe that I use for many of my clients to make your own protein shake at home. It's full of whole ingredients and protein from whole foods instead of having to use a protein supplement. So I would definitely recommend trying to use other things outside of Pediasure, because if you look at the label, all it is dairy, corn, and sugar. That's essentially the only nutrients, and it does not have the methylated forms of B vitamins, and so that's just not a good fit for a child who has autism, because it has all those inflammatory foods, sugars, artificial ingredients, and unmethylated vitamins. So it's not the best fit. For Miralax, I also have a lot of information. I have a full highlight all about constipation, and I talk a lot about Miralax. There are many other ways that we can deal with constipation that are not Miralax. In fact, there are many reports, and I have many reports of parents who also show or share that it can have cause behavioral changes with their children. Now, that's not for everybody, but we do see that. And Miralax is only meant to be used short term. It actually says on the back of the box for 7 days only. So this is something that we definitely need to consider for the kiddos who are constipated, and addressing gut health there too. So on the constipation note that will be in the library, we have tons of other alternative ways to address constipation outside of Miralax. So that could be a really great resource for the other people who are in your clinic. The next question I have is, what foods or supplements can help heal leaky gut? Well, a lot of the foods that we covered today, those foods that have probiotics and prebiotics, but also removing any foods from the diet that are going to be inflammatory for the body. And for some people that might mean gluten and dairy. For some people that might mean removing, who knows what, corn and soy and all of these other foods. So removing reactive foods is one of the first steps. Nourishing the gut with whole foods, removing as much sugar, refined sugar as possible. I still will use fruits in moderation, because they have so many great nutrients and fiber that are also really great for gut health. and other supplements that we can use. Probiotics are definitely one, but I like to use herbals too. So if you want my full answer on that, definitely check out the leaky note or leaky gut note in the library. What do you think about reducing glutamate? So I think that reducing glutamate may be helpful for some people. I think anybody could benefit from removing MSG in the diet. So glutamate is one that we'll cover. We also cover a few different diets that talk about glutamates, special diets in the library, like the Reed diet that talks about removing glutamates. So that is a good one to look up in the library too. Can parents take a training that is SOS feeding approach? Yes, you can. So you can actually go to the SOS feeding website and they have lots of parent resources on there. They even have a few webinars that are free that you can listen to. Now, what I would say for that, while you can do that, and that might be a good place to start to see if it's appropriate and that's, you know, all your child needs. For kids who are really severe picky eaters, oftentimes we really do need a professional like an occupational therapist or a speech pathologist that can really help with that because they are professionally trained to do that. Now, one thing that they can do that, you know, just a parent or even myself couldn't do is diagnose if they had a chewing, swallowing, oral dysphagia, something that's going on that is prohibiting them from trying new foods. So you can learn the SOS approach. And in fact, I teach a lot of the parents that I work with the SOS approach, but I always recommend that they also get in contact with an SOS feeding therapist. Next person, I've heard great things about biomedical beginnings, and as a healthcare provider, would like to view this series as well with my patients. So how do I sign up for the 8-week course? And can I do it at my own speed? So that's a great question. I'm actually going to send in the group chat right now, and I will send the information out in an email. But if you want to go to autismdietitian.com/biomedical-beginnings, you can actually get on the wait list because I enroll 4 times a year. The next time that I'll be enrolling for biomedical beginnings is on October 19th. And so if you're interested in enrolling, go get on the website, go get on the wait list on my website and you can enroll there. I would definitely recommend in the meantime, hopping on the Autism Nutrition Library so that you can educate yourself in between. They're really compatible with one another. They're great companions. So using both Biomedical Beginnings and the Autism Nutrition Library is a really great place to start. So great question. So definitely go to autismdietitian.com. I'm sending that in the chat right now so that everybody can access to it. And I will also send the link directly to the Autism Nutrition Library. So if you decide that you want to join the Autism Nutrition Library right now and secure your spot, then, or secure the pre-sale price, then you can definitely do that right away. So thank you for asking and thank you for sharing with your clients. I'm very confident that it benefits so many with autism, and I've had so many people who have gone through the program who have very, very positive testimonials and really love the program. So thank you, I appreciate it. Then I get a question, the recommended dose for folate for kids. So this person started with liquid folate 1 drop per day. So I don't know what product that is for just using 1 drop per day. The general recommendation for most adults is 400 micrograms. I like to use that with kids too. That is a recommendation across the board from the CDC, that folate recommendation. So it definitely depends for kiddos. Many kids with autism need higher levels of folate. So if you do need more information about how much to use for folate, that is all covered in the Autism Nutrition Library. So I have all of that laid out for you, every single food group, every single age group, every single gender, it's all laid out so that you can find your child's needs and feel confident implementing. And then the other question I got, any suggestions? Are all these suggestions ones that can be applied to kids with ADHD as well? 100%, yes. Yes. Many kids with ADHD also benefit from these changes. a lot of the things that I talked about today, any child could benefit from. It's not just children with autism, but it's specifically implied for kids with autism. Next question, is the Biomedical Beginnings program available to Canadian residents? Yes, it is. So Biomedical Beginnings and the Autism Nutrition Library can be joined by anybody in the world. So if that sounds like something that you are interested in, like I said, definitely go on my website to autismdietitian.com, and I will be sending this link out for everybody who is not able to join. And I'll send that out in the email, but I also just sent a direct link to hop on to the Biomedical Beginnings waitlist so that you can put your name in and be sure that you can get that access. So I've had people in South America, in Asia, Australia, in the UK, and lots of people in the US and Canada who have gone through the Biomedical Beginnings group. Will the nutrition library be available as a phone app as well? So it's available as a web app, so you can pull it up on your phone. It's fully functional. The mobile functioning on the website is 100% compatible with your cell phone, whether it's iPhone or Android. So at this point, it will just continue to be a web app, but I would love to have it as a phone app one day. What testing can be done to see deficiencies? We can test nutrient deficiencies in the blood. We can test it inside and outside the cell. I have a lot of information about this in Biomedical Beginnings. There's a whole section all about nutrient deficiencies. So I would really recommend looking there. I talk about this as well on my Instagram page, so would love to share more there as well. And in the library, we plan on having a lab section where we can break down all of the different types of labs for micronutrients and gut health or toxins, etc. All right. Okay, we got through all of those Q&As. Let's see. Somebody says that they have a bachelor's nutrition. Oh, they're in a bachelor's program and they're looking to become an RD specializing in autism and ADHD. I think that's amazing. We need so much more of us. So, all right. I think we got through all of those questions. Oh, thank you. I just got a very sweet message in the Q&As. Of course, I'm very happy to do what I do, and I truly love it, what I do. You know, whenever you are in this field and have somebody that you truly love on the autism spectrum, it just makes it very rewarding when you can help other families through a similar journey that you've been on to. So I appreciate that. Okay. If I'll take one more question if there are any more, but otherwise I know we are over time, so I'll begin to wrap this up. I haven't gotten any other Q&As. So I will go ahead and start to close down this webinar. Thank you so much, everybody, for joining. Just a reminder, the Autism Nutrition Library, it is on pre-sale, and that ends on Monday. So I will share my screen with you once more to show you this information. I would love it if you joined, and you should definitely lock in that pre-sale pricing, as this is the lowest it will ever be. So you can go to autismnutritionlibrary.com or to bit.ly/ANL/join for $9.99 per month or $99 per year. I want to thank you all so much for joining. We had a great turnout today, so I really appreciate you tuning in and joining me during this webinar. I hope you learned a lot from what we covered today, and I hope to see you either in Biomedical Beginnings or in the Autism Nutrition Library. Thank you so much, everybody.